Good day everyone, I am Dr. Osama Ibrahim from Ease and Different Radiology. Welcome back in the MRI learning step 8. Today my lesson is about microscopic fat versus macroscopic fat MRI signal. This video today is gonna to help you to expand your understanding of abdominal MRI. I will talk for these explanations through 13 different cases. Most of them are microscopic and macroscopic pathology, and also I will explain and recognize these, identify these words which related to the microscopic fat diagnosis. Actually, the T1 out of phase is represented this image of MRI, and this sequence of MRI I don't talk before during the previous 7 presentations about MRI learning, and this is new MRI sequence. Actually, this is a gradient echo sequence, which meaning have a flip angle less than 90 degree, and it is identified by these black lines, which is called India ink artifact or chemical shift artifact, and this out of phase diagnosing the microscopic fat, which can be detected here by the drop of signal, and this is the T1 in phase. These two phases of in phase and out of phase can be are a sequence of gradient echo, and as I mentioned, and can be obtained with the same repetition time but with two different echo time TE values. This is part from physics. The main issue here is how can recognize this sequence by these black lines surrounding the separating the fat from the water. Water here represented in the parenchyma of the liver, of the kidney, of the muscle, and the fat of subcutaneous and mesenteric fat. If you can find this line of black line, sometimes it's called black boundary artifact or chemical shift artifact, India ink artifact, and opposed phase, or this meaning has the same meaning of the out of phase, and this is our gradient echo sequence, and comparing the in phase with out of phase for the dropping of signal to detect the microscopic fat. However, the macroscopic fat, that is the part which I talked before in the previous 7 steps or levels of the MRI I talked before in presentation, and this sequence, as I mentioned before, represented by the suppression of fat in subcutaneous tissue comparing with this T1 which have no suppression of fat, and the suppression of fat can be detected by different MRI sequence, all represented fat suppressions. Like this one, if I find the TI here representing inversion time or time to inversion, so this is inversion recovery sequence and called steer. However, the other two is T1 or T2 fat suppression sequence according to the fluid detections signal, as here fluids within the uterus representing the T2 fat suppressions and this one T1 fat suppression. I think you already know the basis, especially if you are a subscriber, because you would have seen all my lessons about MRI learning in the previous 7 steps. Anyway, this fat suppression diagnosing the macroscopic fat as that lesions which have high signal in T1 which is suppressed in all fat suppression sequence, and these lesions as the ovary, so it is representing macroscopic fatty lesions in the left ovary and diagnosing the dermoid cyst. This is everything about the fat suppressions, macroscopic fat, and gradient echo in phase and out of phase for diagnosing of the microscopic fat. Now we should practice, because the practice helping to confirm the lectures and the presentations. I have 13 different fatty pathology for practice, and I think to get proper benefits from these lessons, you should answer the following 3 questions within 10 seconds for every case. I think also learning this way will help you to make fewer mistakes with MRI film reading. The questions you should answer in the next slides or next 13 cases is there any opposed face MRI sequence like I described before in the first slide in that presentation, and can you recognize this opposed face, which one? And the second question is abnormality representing macroscopic fat or microscopic fat, depending on the first question, because if there are dropped of signal within the opposed phase or out of phase, it representing microscopic fat. And after that, what is the diagnosis according to the diagnosis of microscopic or macroscopic fat, depending also in the previous 2 questions, and according to the site of the abnormality. So let's practice through a couple of cases, 13 cases actually, and let's go. Case 1. As I mentioned, I give you 10 seconds to recognize which one is opposed face as I described before, and then following 2 questions, macroscopic or microscopic fat, then the detections of the diagnosis. Actually, this one is the T1 out of phase or opposed phase. Why? Because these lines, these black lines in the ink artifact. Boundaries the spleen, boundaries the stomach, boundaries the muscle, boundaries everything, separating the fat from the water. So this is the out of phase. And if this one this is the T1 in phase. If there are out of phase, should there are in phase, because these are 2 gradient echo sequence. Where is the lesion? This is the lesions which is dropped in signal, appeared here bright and appeared here dropped in signal. So this representing a dropped signal within out of phase, which representing microscopic fat in that lesion. The third question, where is these lesions? This is the spleen, this is the stomach, and this is the part from the upper bowl of the kidney. So this is the adrenal region. This is the adrenal gland, left adrenal gland, microscopic fatty lesions within the adrenal gland representing adrenal adenoma. Until proven otherwise, need other studies to confirm the diagnosis. However, by this study, you have a high percentage to diagnose adrenal adenoma by the dropped signal in the out of phase. Let's go to the second case. Also, I give the 10 seconds. Where is the opposed phase? This one or this one? Or there are no opposed phase? No out of phase? Actually, this one is the out of phase because there are an outline for the liver, for the right kidney, for the muscle. If you look at this image, there are no this line, this black line, not appeared here. So the boundary artifact or chemical shift artifact, India ink artifact, all this the same name of opposed phase or out of phase. There are opposed phase. So the second question, actually this is the T1 in phase. The second question is there are microscopic or macroscopic fat. If there are drop of signal here of the lesions which appearing slightly bright in the in phase image, so this is representing microscopic fat, presence of microscopic fat. The third question, where is this lesion? This is appeared in the liver, in the right lobe of the liver. Actually at about the segment 5, and these lesions appeared microscopic fat within the liver. If we have history of the oral contraceptive use for 25 years in that lady which have 43 years, so this is raise the diagnosis of the hepatic adenoma which contain microscopic fatty lesions not detected in the original image. And this is the rule of the opposed or out of phase for detections of microscopic fat. So you really need to be careful which type of the MRI sequence you look at to reach for the diagnosis or proper diagnosis. Third case, first questions, is there are any opposed phase in these images or not? Then the second question, is there are microscopic or macroscopic fat? Then reach to the diagnosis through the site of the lesion. The answer of the first questions, there are no opposed phase in these two images because there are no boundary artifact, no India ink artifact. So this is another sequence. Which is this sequence? Look at the subcutaneous fat if it is bright like this. So you are dealing with the spin echo sequence. If you look at the CSF, so it is also dark. So you're dealing with T1 spin echo sequence or fast spin echo sequence. And this sequence, the fat, subcutaneous fats appeared suppressed. So this is T1. Also the CSF appeared dark. So this is T1 fat suppression sequence. Now, the lesions, if it is suppressed like this is bright lesions and suppressed in the next image, which is fat suppression. So now you're dealing with macroscopic fat, not microscopic fat. And if you look for this defect in the kidney, which looks like mushroom-like appearance of the mass with a small renal defect representing a characteristic growth pattern of the renal angiomyelidoma. So this is diagnostic for renal angiomyelidoma, presence of macroscopic fat related to the kidney with mushroom-like appearance and forming renal defect at the site of origin of the kidney. Renal angiomyelidoma is a diagnosis, and this is macroscopic fat, not this is macroscopic fat. Okay. Now with the case 4, is there are any opposed phase in these two images? And if you find it, is there are any microscopic fat? Time out. This is the opposed phase appearing as a boundaries for the organs, separating them from the surrounding fat and muscle also. Okay. So if you have lesion like this in the tail or body of the pancreas, and this is T2 fat suppression sequence because subcutaneous fat is suppressed and CSF appeared bright. So T2 fat suppressions and T1 opposed phase. If you find find that lesions in the tail of the pancreas and look at the signal of it, it is not suppressed at all. However, there are peripheral suppressions or peripheral itching of signal which appearing in the opposed phase, and non-suppression of the lesion in the opposed phase, making a diagnosis of microscopic fat is less likely. If you look at that lesions in the fat suppression sequence, and if you suppose the T1 is have high signal, so this lesions is representing macroscopic fatty lesions in the tail of the pancreas with presence of these peripheral itching. Peripheral itching have a highly diagnostic for the lipoma, lipoma, and according to this site is the tail of the pancreas. So lipoma in the tail of the pancreas characterized by macroscopic fat which appearing suppressive signal in the fat suppression sequence, MRI sequence. However, no suppressions or no loss of signals in the opposed phase, only peripheral itching like this. Case 5. Take care from this pump. Is there are any opposed phase in the slide? Take care from pump. Time out. There are black lines separating the muscle here from the fat. So this is the opposed face, and this one is representing subcutaneous fat which is bright, so it is T1 in face. So this is the T1 opposed face or out of face, and this is T1 in face. What about the lesions? Lesion appeared high signal in the T1 representing a fatty lesion and not suppressed in signal in the opposed face in the center of the lesion. So representing not microscopic fat, it is representing macroscopic fat with peripheral itching representing lipoma or pseudolipoma because the site of the lesions at the region of the capsule of the liver. So it is diagnostic this site for the pseudolipoma of Gleason capsule, and this is due to not suppression of signal in the opposed face, not diagnosed as a microscopic fat, but diagnosed as a macroscopic fatty lesion with this peripheral itching which is characteristic for lipoma and the site of the lesions which is characteristic for Gleason's capsule. So this is diagnosed as a pseudolipoma of the Gleason's capsule. Sixth case, is there are any opposed face within these three images? There are no outline. So time out. So there are no opposed face in these three images. What about this sequence? This sequence is spin echo, and this sequence is spin echo because the subcutaneous fat appeared bright. However, the cystis in the ovary here appeared high signal, so this is T2, and cystis here and other issues appeared dark, so this is T1. T1 fat suppression sequence, and this subcutaneous fat is representing fat suppression, T1 fat suppression, and this is, as I mentioned, the T2 weighted image spin echo sequence, which showing the lesions which high signal in the T1 and not suppressed in the fat suppression, representing not fatty lesion, and also T2 shading sign representing confirms the diagnosis of the endometriomas. This slides only to compare the non-fatty lesion from the fatty lesion, which is the main issue in this presentation. Case 7. Take care from the pump. Is there are any opposed face in these three images? Yes. There are out of face here. There are boundaries. There are boundaries separating water from fat according to the physics of the gradient echo, which is taking the time making these signals or these signs to recognize the opposed face, and there are lesions here. What about this sequence? This is the T1 in face, and what about the fat? Subcutaneous fat is suppressed here, and so this is the T2 fat suppression. What about the lesion which appearing here? Is there are any drop of signal? Yes, there are drop of signal in the opposite face representing microscopic fat. So there are microscopic fat in these lesions. What is the site of the lesions? The site of the lesions in the liver, and also in the fat suppression there are no suppression comparing with the parenchyma of the liver. The lesions is slightly brighter than the parenchyma, so at least there are no fat suppression, no macroscopic fat. So we have lesions in the liver with suppressions or microscopic fat suppression of signal in the opposite face representing microscopic fat at that site representing adenoma. However, sometimes the pathology appearing another issue, but at least it is benign lesions because there are microscopic fat diagnosed by the opposed or out of face, and in the pathological analysis after surgical resections was hepatic angiomyelidoma. Next case, are you ready? Is there are any opposed face or out of face in these two images? Look at the boundaries. Time out. So if you look, there are no boundaries in both images, so you're dealing with the you don't deal with the out of phase images or opposed phase. And this is T1 because the subcutaneous fat appeared bright. Fast spin echo sequence. There are lesions which are appearing bright here, and in the fat suppressions due to suppressions of subcutaneous fat and mesenteric fat, the lesions is suppressed in signal comparing with the T1 image. So lesions with suppression of signal in fat suppressions representing macroscopic fatty lesion. Macroscopic fatty lesions, what is that site of the lesion? This is the spleen, and this is the upper pool of the kidney, and this region of the adrenal gland, left adrenal gland. Lesions with macroscopic fat, diagnostic for the myelolipoma of the adrenal gland. If it is microscopic, it most likely representing adenoma of the adrenal gland. However, macroscopic fat is most common with the myelolipoma. Case 9. Are you ready for 10 seconds to detect the opposed phase? Is this one, or this one? And after that, look at the signal. Okay, time out. This one is the opposite phase. Why? Because there are boundaries around the kidney, around the bowel, around the muscle, separating the fat from the water in the parenchyma of these organs. Comparing with this one, there are no boundaries, no black lines, no India ink artifact. So this is the T1 out of phase, and this is T1 in phase. What about the lesion? The lesions here in the head of the pancreas, this is the signal, and this is the signal in the opposed phase. What about the signal? Is it suppressed or not? Yes, it is suppressed. What about this sequence? This is not sequence actually, not MRI sequence, because the subcutaneous fat is a dark signal and the bone appeared high signal, and this is CT with oral and IV contrast enhancement showing the lesions at the head of the pancreas. From the CT alone, you can diagnose this as adenocarcinoma of the head of the pancreas. However, by the new techniques of the MRI, like this phase, out of phase, you can confirm the presence of the microscopic fat due to loss of signal comparing with in phase, T1 in phase of the lesion, and the out of phase. Loss of signal here representing microscopic fatty lesion within the head of the pancreas, and this is diagnostic for the focal pancreatic lipomatosis, or at least diagnostic for benign lesion, not malignant as diagnosed from the CT. Case 10. Ready for the 10 seconds. Is there are any opposed phase? If there are no, so you're dealing with macroscopic fat. Where is the fat suppression? This is the fat suppression. This is time out. Okay. This is subcutaneous fat. So this is T1. And this is subcutaneous fat with suppressed. So this is fat suppression. Where is the lesion? This is the lesion which appeared high signal and suppressed in the T1 fat suppression, so representing macroscopic fat, macroscopic fatty lesion. What is the site of the lesions? Right ovarian or right adnexal regions, representing mature cystic ovarian teratoma or dermoid cyst, as that lesions due to presence of macroscopic fat due to suppressions in the fat suppression sequence. Okay, case 11. 10 seconds. Is there are any opposed phase here? Yes. Okay. Time out. There are boundaries here. Boundary artifact or chemical shift artifact or India ink artifact representing T1 out of phase. There are out of phase, so there are in of phase image. What about the liver? The liver appearing in out of phase, not loss of signal. This is the signal of the liver, which appearing dark signal in phase and not lost in the out of phase. So this is representing not fatty lesion. diffuse liver lesions, not fatty, and the presence of dark signal in T1 representing dense liver, and not fatty component representing primary hemochromatosis. Hemochromatosis of the liver is diagnosed primary because the spleen is not suppressed like it. So the diagnosis of hemochromatosis also can be helped by this sequence T1 out of phase, which diagnosing not presence of fat at that slide. Comparing with this lesion, take your 10 seconds to compare these lesions with the previous one to know the rule of the out of phase. This is the out of phase, which is showing the boundaries, and now this is the T1. T1 showing the liver is slightly brighter than the spleen, and in the out of phase there are loss of signal, completely loss of signal. So this is diagnostic for the fatty liver, and this is the how to differentiate the fatty liver from hemochromatosis through out of phase. So this is the diagnosis of fatty liver. And this is the last slide, case 13. Take your 10 seconds to find where is the opposed phase from these. All these are T1 sequence. One of them is opposed phase. This one is opposed phase due to presence of these lines, which is separating fat from water. Look at that regions, at the prevertebral regions and the vertebra and the muscle and the fat. And this one is the T1 in phase, okay? However, this one, due to presence of bright fat here and low signal on the CSF, so this is one is the T1 spin echo sequence or fast spin echo sequence, and this one with contrast. Fast fat suppression with contrast. All are T1, and this is the opposed phase. Go to the opposed phase if there are any drop of signal comparing with in phase. These are gradient echo sequence. There are no drop of signal, and this one method for diagnosis of the widget vertebra, which appeared here widget and low signal in the T1 and have contrast enhancement, and there are another lesions also in the vertebra. This one method to diagnose metastatic deposits in that lady which have breast cancer, known case from the widget vertebra due to osteoporosis or due to any cause. So this is vertebral metastasis. Why? Because in out of phase there are no drop of signal. If there are drop of signal, it representing a fatty component, and the fatty component most likely occur with the widget vertebra due to osteoporosis. In that case, not happen that scenario. So this in out of phase there are no loss of signal, so there are no fatty component, so it is diagnostic for the vertebral metastasis also. Finally, to summarize my presentation, there are microscopic fat and macroscopic fat. Microscopic fat have loss of signal, recognized by loss of signal on out of phase. However, macroscopic fat have loss of signals in fat suppression sequence, T1 fat suppression, T2 fat suppression, stir image, spare, and proton density fat suppression. Any fat suppression, the loss of signal representing macroscopic fat. Examples for microscopic fat, as we mentioned in our presentations, adrenal adenoma, hepatic adenoma, pancreatic lipomatosis, hemochromatosis versus fatty liver, and vertebral wedging osteoporosis versus metastasis. And examples for the macroscopic fat, lipoma and other lipoma like dermoid cyst or angiomyelidoma, adrenal myelolipoma, and the pseudolipoma of Gleason's capsule. Thank you very much for your watching. Well, I hope this lesson has helped to make a few things clearer for you. If you have got any questions at all, just pop them in the comments under the video. And don't forget Wednesday MRI learning lesson every Sunday, rapid review anatomy and Arabic presentations every Friday. Have a nice time and thank you.